Welcome to this episode of Diaspora Scholars TV. So we are at Mariott Hotel in Morgantown in West Virginia, and I just met Dr. Gregory Gandhi, who is the CS Health and Sanitation, Kisumu County, Kenya. I tell you, I'm so excited to have met you because for some reason you reminded me about the governor of Kisumu.
Good.
And it turns out that I've seen you on TV. It's amazing to meet you.
Thank you.
But now our viewers want to find out, what is the CS doing in the US? Tell us a little bit about your journey to the US and what you are here for.
All right, thank you. I'm in the US for several things, but today I came for the visit to YUNIGEN Company. YUNIGEN Company is a company that is made up by, actually conceived by Kenyans living in diaspora in the US to manufacture a drug that takes care of sickle cell disease, especially in children. It's called hydroxyurea. So Kisumu was one of the biggest programs. One of the biggest problems we have is sickle cell, where a good number of our children don't make it to 5 years. We have a lot of social devastation because of costs, families breaking up, women being chased because of witchcraft and all those kind of things. But the root cause of this is sickle cell disease. In fact, we think that our mortality rates, child mortality rates are actually high, not because of poor services, but because of undetected sickle cell. So we set up a program to take care of sickle cell clients, first of all by doing newborn screening, which we started around 4 years ago. That's now giving us the numbers that we're around 3% of children born have sickle cell, and around 20% have a trait. And now we are moving forward from there to treat them. Just last week we opened a new center at Victoria Hospital that will be dedicated to sickle cell training, sickle cell treatment. And now I'm here in the US to look at about the issues of drugs for these children. Unigen is producing hydroxyurea, and we want to be the first people to get this hydroxyurea so that we can make it affordable for the people in Kisumu, particularly Victoria Hospital and the sickle cell clients. As a pilot, then it can now move to other counties where they can get access to this drug at an affordable rate, and one that can be used as a formulation for children.
Wow. That's a very novel initiative, because you are looking at reducing child mortality rate, improving healthcare of the residents of Kisumu County. And I mean, over the last few years, I've seen lots of changes in the health sector in Kisumu County. I mean, speak a little bit to that. Last time I was at the Kisumu, it used to be Kisumu General Hospital. What do you call it now?
It's called Jaramogi,
JOTRH. I saw changes over there. I even saw the one that used to be near is it this park? The one that used to be
That's Kisumu County Referral Hospital.
Yeah, exactly.
Yes.
It's very different. So tell us a little bit about the kind of changes that you have been able to bring about in the health sector with the assistance of Professor Nyang Nyong in Kisumu County. Tell us a little bit about that, because I know you are, as you said, you've come here to bring about opportunities for medication, but I know you also have other plans. But first of all, speak about the changes in improvement in healthcare in Kisumu County.
Thank you. I think that's a very nice question. It's passionate. But if you looked at whatever we were doing in Kisumu, we decided that the old type of medicine and the Western kind of thinking, and that's what brought problems in Africa, was that people need to go to hospitals. And so our healthcare was designed as hospital-based. And so usually hospitals see sick people. When you get sick, you go to the hospital. So then you end up with more sick people, and the solution has always been bigger hospitals and more bed spaces. So we decided in Kisumu we're going to change that. And we're going to move towards preventive health.
Okay.
And why? And remember I was...
so more on primary healthcare.
Primary healthcare, yes. When I was working in Jaramogi, I was the director of clinicals. We had so many guys who were getting stroke. And coming in because of stroke, and we were being told we need more ICU space. Then we said, what is the cause of this stroke? The cause actually was hypertension, diabetes, which is not managed. So what we did in Kisumu, we decided to formalize the African way of doing things, community health services. So we were the first to train, enumerate, and certify community health workers. I think that's what the national government learned from, because once the policies were set, we decided to go head on. And that was our biggest game changer, yes. Because after that, the number of patients who were coming with diabetes and hypertension to the hospitals went up 4 times.
Wow.
Yes. So the huge number of people who are the base, who are not coming to the hospital, now found their way into the hospital. The second thing we did was now moving into the primary healthcare facilities. Because all these guys come to the facility, you must improve the facilities so that they're able to screen and treat those ones who have minor illnesses and then refer those ones.
Okay.
So we did that, and we decided we're going to have 1 hospital per ward, what you call a comprehensive center.
Okay.
And we're calling them health and wellness centers.
Oh,
because
you have incorporated the wellness component.
Yes.
Yeah.
Yes. So that,
which has, for many years has been totally been neglected.
Yes, because we were used to a place where you go because you are sick. We don't want you to go because you are sick. We want you to go because you are well, and you want to find out how can I prevent myself from being sick. Yeah. So we have done 35 wellness centers. We hope we are going to improve those numbers. The third thing we did was now improve on the referral system. Yeah. We built an emergency operation center. We made sure that we have a coordinated ambulance system so that anyone who is coming from down there can go up. And I think that was the first properly done emergency operation center, publicly done. And we are doing almost 10 times what Red Cross is doing in the country. Wow. Just Kisumu alone, yeah. So maybe around 12 to 20 referrals in a day being managed from our emergency operation center. Accidents, we're also doing public health emergencies, cholera outbreaks being managed from that center. Yeah. Then from there now we decided to upgrade our Jaramogi Hospital. Remember Jaramogi Hospital was a level 5. Yeah. It had 400 beds, it was not well run. So we decided to build more. We did total facelifting, cabro works, glass facade. We added 1 floor, put up a new mortuary, put up a physiotherapy center. We did renovations, painting of the whole facility, new borehole.
There was a new borehole?
Yes, yes, yes. So that then you can take care of the water, cleanliness, and all that in the facility. Then we took several doctors for training. Yeah. I think we had 65 doctors sent for training in masters, and then built on our relationships.
Hold on that, you took doctors for further training?
Yes.
Is there a component of making them stay in Kisumu County?
Yeah, they are bonded. They are bonded. But you can never retain 100%. Because some of them will disappear, but at least a good percentage of them are yet to come
And it's
back.
also going to encourage more to stay in Kisumu County?
Correct. And of course, we also took our specialists for subspecialty training. Yeah. One of the things we did with our colleagues in diaspora is a neurosurgical camp. We have neurosurgeons who come from the US and from Germany every 3 months. So these 3 months, the US, the next 3 months, the Germans. And they're there for 2 weeks. They just do neurosurgery.
From which hospital, which program?
No, it's called the Kisumu Neuroscience Initiative.
Oh, really? So you go outsourcing, or is there a program already in place with certain...
Yes, it's a program in place, but it's actually doctors in diaspora who come from that region, giving up their time for no pay.
Wonderful.
Yes, they use their own money to come, they fly in, they sit down, they do surgeries for 2 weeks, and then they leave.
That's why I really wanted to talk to you, Dr. Gregory, because that's why I wanted you to speak to that camera. If there are people who want to be able to support Kisumu County, health facilities, including providing services, speak to them.
Yes, thank you. If you're in diaspora, you need to do something back home. We are back there at home. You can have an impact by offering a few weeks of your days every year to come back home and build the specialities. There is no way we are going to build by trying to poach. We are only going to build by people coming from back from those places which are developed to bring that knowledge back. This is what Indians did. Indians developed the health system by those ones who had gone to the US, Europe, who came back and set up centers within there. So even if you don't want to come back full time, but you can offer 2 or 3 weeks, You come, work with those people. That knowledge that you transfer eventually will lead to improved services. And I've talked about neurosurgery. We have, I think, one of the best neurosurgery programs in the country right now.
Yeah.
We have patients coming from Ethiopia, from Uganda, from other countries to come for that. Yes.
That's why we do this, folks. At Kenya Scientists in Diaspora, we provide these initiatives and opportunities to provide services and improve back home. It's a question of changing brain drain to brain gain for the sake of our own people back in Africa. We'll put a link of Dr. Gregory Gandhi under the description of this video, and also you'll be able to directly go to the website of Kisumu County and be able also to find out about what he's talking about. I want to thank you.
Thank you.
You are a great man.
Thank you very much.
But it's not ending here. You are going elsewhere after here. Where are you going?
I'll be going to Kansas. I have some research projects I'm doing.
Yes.
It's a cancer registry. It's a digital application.
Talk about that.
It's a digital application that is able to follow up. One of the problems we have with cervical cancer screening is you screen and then the women get lost to follow up, or don't even know what kind of work you're doing.
Yeah.
So we developed an application as a research, and we are doing it at the University of Kansas, where we feed in all this information, and we're able to track and follow up the woman until she's better and until she's referred.
Wow.
But also I'll be giving a talk to students and lecturers in the University of Kansas on what we are doing in Kenya, actually not Kisumu alone. I also work for the National Cancer Control Program. I consult for them. So I'll be talking to them about the transformations in terms of cancer screening and cancer treatment that Kenya has undergone in the last 3-5 years to be where it is right now.
Oh my goodness.
Yes.
I wish we'll find a way to get his presentation as well. And if it's possible, we're going to see whether we can be able to come to Kansas and record you as well, because we are really encouraged by people who come from Kenya, come to the US with particularly good reasons to go and solve problems back home. You've not come here to just attend a conference and go back. You've come here to find medicine for the people of Kisumu.
Yes.
You've come here to attend a conference to create these cancer registries to help the people of Kisumu. And you're not stopping there.
Yes. After that, I'll be going to the American Psychiatry Association. They're having a conference, but this time now, it is them learning from us.
Yes.
From the community work that we've done, I think Americans are coming to realize that the kind of system that they're running does not favor primary health care. So they want to learn from us what we are doing in terms of community health and community health workers, that we're able to go door to door. You can actually digitize, you can have everybody's records on a digital platform, and then follow up these people with better returns. So the psychiatrists are interested in this, and I'll be giving a speech or a presentation to them next week. To a few colleagues of mine, yes. So I'm here for 3 things.
Wow.
When I finish Kansas, I go to LA. When I finish from there, I go back home.
You are watching Diaspora Scholars TV. This has been Dr. Gregory Gandhi. Previously, you were the Director of Clinical Services at Kisumu General Hospital.
Yeah, Jaramogi.
Jaramogi?
Yes.
I keep on confusing, that's why we need to go back home, folks. We stay in the diaspora. I wanted to ask, there used to be an Obama blood cancer donation center at Jotiar. Is it still
Obama Pediatric Hospital.
Is there Obama Pediatric Hospital?
No, it was Obama Pediatric Hospital.
Oh, it was Obama.
It was built by Obama.
Oh, really?
During Obama's time, not built by Obama, during Obama's time, when he was a senator.
It's a pediatric hospital?
Yes, it's a pediatric hospital. So
it's not just a blood cancer center?
No. It's a full pediatric hospital. It can function by itself. It actually runs almost semi-autonomously,
Oh, wow.
So it's part of Jaramogi. It's a children's wing, but it has an accident, an outpatient, an accident and emergency wing, inpatient. It has everything that a pediatric ward should have.
Amazing. And finally, because this show is normally watched by some young people as well, there are people who are looking at you and they say, I want to be Dr. Gregory Gandhi right now, if he's been able to leave an impact, because they are very tech savvy. Once they watch this video, they're going to begin Googling. And so give a message to them, the young people here and in Africa who want to be aspired to be a successful doctor as you, and also be a real health administrator, providing real solutions to the people of Kenya and Africa in general. Give them a message, because to be a doctor is not easy, is it?
Yeah, that's true. I always tell people, and I was just discussing with my colleague Charles a few minutes ago, that if you want to have anything in medicine, don't chase after the money. If you're chasing after the money, you will never have impact.
Wow.
Chase after the impact. Do the work, the money will follow you. But chase after the money, the impact will never follow you. That's my advice to you. Thank you.
That is Dr. Gande. This is Diaspora Scholars TV. They call me Daktari.
Asante sana.
But you'll find out my Daktari what it is.